Hey guys, this is FixerMed. Welcome back to my high-yield immunology review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. In this series, I will be covering the entire discipline of immunology in a comprehensive but high-yield manner. This will be part 18 of my multi-part video series of doing so. Without any further delay, let's go ahead and get started on today's content. Today, I'd like to open up the presentation by covering an overview of vaccines. Killed vaccines are used to treat rabies, influenza, IM, polio, Salk, IM, pertussis, hepatitis. A. Live attenuated vaccines are used to treat yellow fever, varicella, rotavirus, oral, influenza, intranasal, polio, Sabin, oral, MMR, typhoid, oral. All right, moving on. All right, next topic, mechanisms of immune response. Killed vaccines, humoral antibody response via MHC2 expression post-phagocytosis. Live attenuated vaccines, MHCI expression by nucleated cells, generating CD8 plus T-cell mediated response. Safety considerations, MMR and varicella suitable for HIV patients with CD4 count 200 cells UOL. All right, moving on. All right, next topic, specialized vaccine types. Recombinant vaccines, HPV. Mechanism, recombinant DNA technology produces antigens. Toxoid vaccines, diphtheria, tetanus. Mechanism, toxins chemically modified for reduced toxicity, inducing antibody production. All right, now that we have covered all of the content for today, let's look at some NBME-style multiple choice questions to test your knowledge. A 45-year-old male presents to his primary care physician for a routine checkup. His medical history is significant for no vaccinations in childhood and no recent travel. His physician recommends catching up on vaccinations. Which of the following vaccine types is administered orally? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. Polio vaccine, specifically the Sabin vaccine, is administered orally. The Sabin vaccine is a live attenuated vaccine, which includes the oral polio vaccine, OPV. It contains weakened forms of the poliovirus strains and is administered orally as drops. This route of administration allows for mucosal immunity in addition to systemic immunity, making it effective in preventing polio transmission. Therefore, the correct answer is E, polio, Salk, IM. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A, rabies. Vaccine is typically administered via intramuscular injection. B, varicella. Varicella vaccine is administered subcutaneously, not orally. C, hepatitis A, hepatitis. A vaccine is administered intramuscularly. D, influenza, intranasal. The intranasal influenza vaccine is administered intranasally, not orally. However, it is a live attenuated vaccine. All right, now that we have covered this question, let's move on to look at the next question. A 30-year-old HIV positive patient with a CD4 count of 250 cells/UL presents to the clinic for vaccination. The physician recommends catching up on missed vaccinations. Which of the following vaccine types is most suitable for this patient? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. Varicella vaccine is a live attenuated vaccine and is suitable for HIV patients with CD4 count 200 cells UL. Live attenuated vaccines like varicella and MMR can generally be safely administered to HIV-positive individuals with CD4 counts above 200 cells/UL. because they do not pose a risk of causing severe infection in immunocompromised individuals. However, caution should be exercised when administering live vaccines to patients with lower CD4 counts, as they may be at increased risk of developing vaccine-related complications. Therefore, the correct answer is B, varicella. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A, rabies. Rabies vaccine is not live attenuated and does not have specific safety considerations for HIV patients with CD4 counts above 200 cells, UL. C, hepatitis. A, hepatitis. A vaccine is not live attenuated and does not have specific safety considerations for HIV patients with CD4 counts above 200 cells, UL. D, influenza, intranasal. The intranasal influenza vaccine is live attenuated but is not specifically recommended for HIV patients with CD4 counts above 200 cells, UL. E, polio, Sabin, oral. While the Sabin polio vaccine is live attenuated, its safety in HIV patients with CD4 counts above 200 cells, UL, is not specifically mentioned, and it may not be the most suitable choice for this patient. All right, now that we have covered this question, let's move on to look at the next question. A 25-year-old female presents to her gynecologist for a routine checkup. She mentions that she has not received the HPV vaccine and is interested in getting vaccinated. Which of the following vaccine types is produced using recombinant DNA technology? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The HPV vaccine is produced using recombinant DNA technology, which involves inserting the genes that code for the HPV virus's surface antigens into yeast or mammalian cells. These cells then produce the viral proteins, which are purified and used in the vaccine. This method allows for the production of highly purified antigens without the need for live viruses, making the vaccine safe and effective. Therefore, the correct answer is D, HPV. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A, influenza, intranasal. The intranasal influenza vaccine is a live attenuated vaccine and is not produced using recombinant DNA technology. B, diphtheria. Diphtheria vaccine is a toxoid vaccine and is not produced using recombinant DNA technology. C, tetanus. Tetanus vaccine is a toxoid vaccine and is not produced using recombinant DNA technology. E, hepatitis. A, hepatitis. A vaccine is produced using inactivated virus particles and is not produced using recombinant DNA technology. All right, guys, that is all I have for the video today. As always, be sure to leave a like and subscribe to the channel for more videos like this if they are beneficial to you. If you have any questions, comments, or concerns, please feel free to type them up in the comment section below. Anyways, guys, this is FixerMed signing off. Be sure to have a great day, everyone. Good luck studying as always, and goodbye.